Okay. Hi, everybody, and welcome to our smoking webinar, a part of our Be Healthy webinar series. As you can see from the slide, we've got loads and loads of really good speakers with us today. So we have Vicky, Louise, Syeda, Cassie and Richard. Full names and titles are on the screen. They're going to take us through lots to do with smoking during COVID and offer some practical advice and guidance for you as well. So just before we do that, I'm just going to do a bit of housekeeping and then run over the Be Healthy webinar series. So as you can see from the agenda, I'll do the introduction and then the majority of time will be for the speakers. We'll then run over a Q&A and discussions at the end. So any questions you have, if you type them in the box as you go, we can pick them up at the end. So moving on to housekeeping. Just a few things to help the webinar run more smoothly. So if you can stay muted and turn your camera off when you're not speaking, it will just help us with the bandwidth. Also, if you have a VPN on your computer, so maybe NetMotion or Cisco that you use to connect to a work server, it's also helpful if you turn that off too. We do welcome questions and answers, or questions throughout and discussion throughout the webinar. If you have a question, if you type in the chat box function, that would be really helpful. We do recognise, sorry about the background noise, I think they're doing some roadworks outside our house. We do also recognise that not everybody wants to ask all of their questions in front of everybody. So if you prefer to drop a private email, you can email us at the Healthy Brum email address, which is on this slide, and it'll be on the last slide today as well. Lastly, as we've already said, this webinar is available to record. So if people can't join us today, or you know other people that would like to listen afterwards, then please signpost them to it. We'll share the link of where it will be at the end, and all participants will receive it in an email as well. So just before we move on to the smoking specific content, just a really quick overview of Be Healthy and what Be Healthy is and why we're doing it. So it's a series of practical resources, part of which is the webinar series. We also have a list of downloadable resources from our website as well that include an overview of Be Healthy, but also a checklist to a healthier you that includes something about all of the webinar series, and is a practical resource that communities can use. They can download and they can use it as a checklist to see if there's things they could do more of or less of, or different things that they could change. And there's also a planner to help facilitate that behaviour change that they might need. The idea of and all of those resources are translated as well, so they're available to download in up to 20 different languages too. The idea of all of it is that we can support people who are working with communities to support their communities to reduce their risk of becoming seriously ill from COVID, and all the topics that we've picked for the webinar and inclusion in the resources are specifically linked to COVID and things that you can do to improve your outcomes and to generally improve your health. As you can see, the webinar link for bookings is at the bottom of the page. It also is that's also where you can download the resources as well. So if you have any other questions, please drop them in the chat or get in contact with us separately. And at that point, I'll hand over to our first speaker. So over to Vicky, who's going to talk about the QuitForCovid campaign. Thanks, Vicky.
Hi, everyone, and thanks, Stacey. Hopefully you're okay to move the slides forward. That's great. So I'm just going to talk a bit about the QuitForCovid campaign and the work that Action on Smoking and Health has been doing around COVID-19. So just starting off with what we currently know about COVID and smoking. So the first thing to say is that the evidence is still evolving. So obviously, you know, COVID-19 is still quite new. We've only been researching it for the last few months. So the evidence is evolving. But it currently suggests that current smokers who receive a test in the community are a little bit less likely to test positive for COVID-19 than non-smokers. And that's obviously you know, quite interesting, but also there may be a whole range of reasons for that. It might be that smokers are more likely to have a cough, so they might be more likely to get a test than non-smokers. What we are seeing, however, is a slight increase in risk for smokers hospitalised with COVID-19. And as I say, this evidence is evolving and changing slightly. but it is suggesting that smokers might be at slightly higher risk of worse outcomes if they catch and if they are hospitalised with COVID. You might have seen in the news, there's been stories about nicotine potentially being a protective factor and suggesting that this could be another reason why smokers are less likely to be testing positive. And just to emphasise here that this hypothesis is unproven. There's research going on at the moment to test out this idea, but at the moment, we don't know whether or not that's true. What we do know is all of the harm that smoking causes, and smoking is responsible for over 200 premature deaths every day in England. So that means it is always better to quit smoking, but there's possibly an additional incentive at the moment for people to use products like nicotine replacement therapy, so patches or gum, to help them in their quit attempts. So looking ahead to winter and the current sort of state of play, thinking about protecting our NHS and making sure that our health system has the capacity to respond to COVID, we know that smokers are 5 times more likely to get flu and that they're twice as likely to get pneumonia across the winter. So this is an important sort of factor to be thinking about when we're having conversations and encouraging people to quit. Smoking is also a leading cause of some of the health conditions that are risk factors for worse outcomes from COVID-19. And as it says there, in 2018-19, there were over 500,000 smoking attributable hospital admissions. So smoking under normal circumstances can put quite a lot of pressure on the health service. So it's really important that this year, more than ever, we're doing what we can to motivate and support smokers to quit. So motivating and supporting smokers to quit right now, as I just said, reduces the burden of ill health and may help support people in protecting themselves from COVID-19. We know that COVID-19 is exacerbating existing health inequalities in society, and tackling smoking is really a key part of that solution. Smoking and higher rates of smoking are associated with every indicator of disadvantage, whether that be economic, whether that be social. So we know that tackling smoking rates is a really important part of reducing health inequalities. Quitting smoking also improves treatment outcomes, and we've talked there about improving survival rates after a cancer diagnosis, which could be important in the context of late diagnoses. However, it's also important around recovery from surgery. We know that wound healing is quicker among non-smokers and people who've quit smoking. So there's a range of reasons here to support and motivate people to quit. And then finally, economically, smoking, as you may know, is very expensive. And we've also, Ash has published some recent research showing that smokers are less likely to be in employment than non-smokers, and that smokers who are in employment are actually earning slightly less than their non-smoking colleagues. And that's amounting to approximately £14,000 a year for people in the West Midlands. So that's, a lot of money for people, especially at the moment in the context of job uncertainty and economic uncertainty. So another sort of motivating factor there. So what we are seeing is that in response to COVID-19, motivation to quit smoking is up. So last year, previously, we know that most smokers say that they want to quit, but at the moment, a quarter of smokers are saying that they're more likely to do so short term, and around 20% of smokers have actually started smoking less because of COVID. And then finally, what we've seen is during the lockdown period from sort of March through to June, approximately 1 million people in the UK quit smoking. And that includes, as it says there, nearly 100,000 in the West Midlands. So that's a really important impact. But also what we now need to do is make sure that we're supporting people to sustain those quit attempts. So it's not just a short-term quit, but that we're helping those people to stay smoke-free long-term. The flip side, of course, is that not everybody who is trying to quit is succeeding. So nearly 500,000 smokers have tried to quit during COVID, but have been unsuccessful. we know that around a quarter of smokers are smoking more than usual, and around 1 in 10 smokers are reporting that they're smoking indoors more often. And that obviously has knock-on impacts on children and family members in regard to exposure to secondhand smoke. And what's interesting is that smokers with respiratory health conditions, which we know make people more susceptible to COVID-19, appear to be no more likely to quit than other smokers at the moment. So what's important there is around, again, having conversations with people and when we're thinking about motivating people to quit. And then there's also mixed reports coming out from some of the groups of population groups that we know have particularly high smoking rates. For example, people with mental health problems are seeing quite high quit rates. So they are more likely to have quit during lockdown than other smokers. And they're more likely to report that they have started using an e-cigarette. So that's an indicator, a tool that might help them stay quit long term. However, among people with mental health problems who haven't quit, we see that 40% of smokers with mental health problems report that they're smoking more and smoking more regularly. And they're also more likely to, again, say that they're smoking more indoors. And as I said, that's an issue obviously around exposure to secondhand smoke, which we know is very harmful for people's families, friends, and others in their household. So what ASH has been doing is a communications campaign, which started actually with a GP who got in touch with us and said, what about using this idea, Quit for COVID? And we've taken that and run with it to create both the sort of Quit for COVID campaign and the Today is the Day campaign. And there's some of the adverts that we've been using on screen there. And we've had brilliant support, I must say, from local authorities right across the country, including Birmingham. And I think the really key message there for people, particularly at the moment, is that it's never too late to quit smoking. Health benefits of quitting start within 8 hours when we see that levels of oxygen in people's blood starts to increase. Over the next few days, people's lungs start to clear of smoking debris. So there's really important and immediate sort of benefits to quitting that we need to really focus on communicating to people. And ASH has been producing a lot of resources to help local authorities, healthcare practitioners, local community leaders to communicate with people about smoking and COVID at the moment. So what you can see on screen here is a Quit for COVID frequently asked questions. So that covers all the evidence around smoking and COVID-19, what we know in terms of risks or the likelihood that smokers are going to contract COVID. And that's being regularly updated. So we're updating that in line with research and academic evidence as it appears. And then on the other side of the screen was just the campaign toolkit. So that includes some suggested campaign messages, links to access support, and it also includes a load of assets such as social media posts, template graphics and resources that you can adapt with local information, resources for your websites, and also template press releases and materials. So lots of resources in there that can help you if you're wanting to spread this message and motivate people to quit for COVID. And this is just continuing on that theme, just some other resources that are available. We've got a brilliant set of case studies available on a website called Today is the Day. And they are stories of people that have quit during the COVID-19 period and their motivation and rationale for doing so, how they got inspired and how they've gone about quitting. And then the Today is the Day website also has some practical resources and support. It directs to NHS advice on the best ways to quit and how you can get support, and also some further information about you know, why it's a really important time to be motivating people to quit smoking. And then finally, I just wanted to share some other resources that ASH has that might be helpful in taking forward local conversations about smoking at the moment. So what you can see here is the ASH local toolkit and then our local alliances roadmap. So that includes resources on smoking and housing. What we've seen from our work over the last year is that quitting smoking can help people go a long way towards making sustainable financial decisions and supporting people to remove rent arrears, get on top of finances. There's also a smoking and health inequalities resource pack that you can see there that has a range of information about smoking for different, say, population groups, smoking and mental health, smoking and pregnancy, which I know is going to be picked up on later in the presentations. So a lot of information, materials there that should be really helpful for anyone looking to take forward conversations about smoking and COVID. So hopefully, I think there have been a few questions coming in. Louise, I know, is going to pick up on a lot of these themes, so I hopefully can hand over to her.
Thank you, Vicky. Thank you, Vicky. That was really, really useful, and so much information there that I think people might take away and digest as well. A couple of key messages though that struck home to me is it's never too late to stop smoking, and the benefits you could gain by doing so are enormous, and there's so many resources out there, some of which are here, and I think we're going to talk about other things throughout the rest of the webinar. So thank you so much, Vicky. Are you staying around for the webinar?
Yes, yeah, I'll be on.
Yeah.
Be on.
So we'll pick up all the questions at the end. So that's great. Thank you. Okay, Louise, over to you now. Thank you.
Thank you very much, and thank you, Vicky. That was lovely. I share your resources so many times because they're so very, very good. So I'm going to talk about Quit for COVID and beyond. I was involved in the Quit for COVID campaign, and I did a week on, week off Twitter clinic throughout, well, from about April through to August, to talk to people about quitting for COVID. I think we learned a lot, and we learned how to move things on as well, how to make progress out of what we learned from that. So this is about, you know, how to make the most of it. Next slide, please. Thank you. And I thought it'd be useful to go through the reality of people's lives, you know, the people who we're talking about, because you often talk to people who can't really understand why they're still smoking at all. You know, people will say to me, like, everybody knows that it's bad to smoke, that people should have stopped. Why are they still doing it? And I think examining that shows, you know, sheds some light on this. Often they started smoking at a really young age. So I think it's really wrong to blame people for smoking when, you know, they had very little control over this when they started. Some started as young as 11 and live in families where most people smoke. So it's just such a normal thing. Often they'll feel uncomfortable about quitting. And I've put a reference in there that you might want to look at. They don't necessarily buy at shop prices. So telling people, well, you could save, you know, over £10 a day doesn't cut it so much with people that are buying illicit tobacco at £3 a packet. They find ways of making it affordable. They often think that getting help is a sign of weakness, that going for help and support to stop smoking is something that sissies do. It's not for them. And I think it's really important for frontline staff to get that message out that, you know, that there's lots and lots of help available to stop smoking, and that it increases your success so much to actually get some structured help to quit. Sometimes when they quit, especially those that just do it on their own, they miss their cigarettes like they've lost a best friend. It's about me time. So somebody will, you know, do some of their shift, they'll go outside for a cigarette, they'll do the washing up and clean the house, they'll go and have a cigarette, they'll, you know, visit a friend in hospital, and after that need some me time, and smoking fills that place. And as we know, many have other issues that they're trying to deal with, mental health issues, not necessarily severe enough to be admitted to hospital with, but low-level mental health issues that make their life more difficult, and they find that smoking is what gets them through. But unfortunately, it's what threatens to cause premature death, long-term illness and disability as well. And that's why we take it so very seriously. Next slide, please. And the effect of quitting is quite remarkable. The benefits that people see very, very quickly, as Vicky said earlier, the health benefits kick in so very quickly. The financial benefits, people have said to us in the Stop Smoking services that they can't ever remember a time when they had money left at the end of the month. This is so important. Their general well-being and they have more energy, they have a brighter outlook on life, they influence others as well. Once they've stopped smoking, they will have an influence on other people in their friends and family circle who also really need to stop smoking. Their general health improves, and as Vicky said, the effect on smoking-related illness is quite key. Next slide, please. So what we learned. Frontline staff that logged on to the website, the Today's the Day website, and followed the Twitter clinic were really important to get that message out about stopping smoking. Some people thought that smoking could protect them, and we talked to one man who contacted us on the Twitter clinic quite a lot, saying that he was making himself smoke. He didn't want to, but he was making himself smoke because he thought it would give him protection. Now, he didn't want to go public, and a lot of people felt the same, which is why I've said in the bullet points that Twitter isn't necessarily the go-to place for stop smoking advice. People can be quite shy, so we found private messages on the Twitter clinic were quite a popular way to get advice. But we certainly made the most of the clinic to give frontline staff a message that they could take out to their service users, their patients, their clients, about how important it is to quit for COVID. Next slide, please. So what can frontline workers suggest? It's important to say that the use of pharmacies, GPs, a vape shop, using an app can be really important. At the moment, we've got the Stoptober campaign going on, and there's heaps of information about where people can go to get help to stop smoking. If you look for Better Health Stoptober, you can see all the resources that are there. And frontline workers are very welcome to use these suggestions too. We sometimes hear from frontline workers that they're a bit shy about using these ideas themselves. They're happy to pass the message on to their clients, but in fact, if they smoke as well, this is a really good opportunity for them to stop, and then they can relate more easily to their service users or patients about what they're going through. Next slide, please. Nicotine having a protective effect. As Vicky said, for COVID, it may do, we don't know, but for relapsing, most definitely. So somebody who has quit smoking, got through to week 1, week 4, 3 months, remembering that, and I suppose what I'm addressing this about particularly is the people who have been vaping. Continuing to vape is quite important to make sure that they don't relapse. And I'm certainly, as a stop smoking expert, I'm not afraid of the idea of people continuing to vape. It could well stop them reaching for a cigarette next time they have a bit of a crisis. But certainly for a successful quit, clean nicotine through nicotine replacement therapy or vaping, really important. Next slide, please. And we have to deal with a lot of misinformation about vaping. Linda Bold describes it as fire hosing, that there's so many wild opinions, like popcorn lung, the fact that it might re-normalise smoking. There's a lot of myths out there, and it frightens people into stopping vaping, and it could push them back to smoking. So I think it's really key that people who are talking about vaping to their patients or service users who need to quit have some accurate information about what to say rather than inaccurate information. Next slide, please. So this is my my summary, I guess, that it would be really good if people who smoke make at least one attempt every year to stop smoking. We hope that one of those attempts will work, that, you know, one year they do it and they say, that is going to be the last time I put myself through this. You know, we don't want them to undo all that good work that they put into a quit attempt. We want to make sure that this one is the one that sticks. All frontline staff, we really encourage you to nudge people to try this. And you can say it in a very non-judgmental way. You know, have you tried to stop smoking this year? There's lots of good information out there. There's all sorts of ways that you can do it without making it sound as though you're nagging. Because it's not about nagging, it's about a better quality of life, more money in your pocket, a brighter outlook, and an ambition to achieve other health improvement goals. We often hear people saying that once they stopped smoking, they were able to not only walk up the stairs more easily, but, you know, start cycling, start walking more. So this is about wholesale health improvement, and we're glad that you're happy to join us on this journey. Thank you.
Thank you, Louise. A really interesting again, and a real clear call to action for everybody who's listening into the webinar today, and a clear question that we can all ask. So thank you for that. So moving on now, we have Rachel Hill from the Public Health team coming to talk to us about the local provision that's available in Birmingham. So Rachel, over to you. Is Rachel with us, or is it Syeda?
It's Rachel.
Oh. Sorry, I just tried requesting control and then it wouldn't let me show my
So okay, over to you anyway, Rachel. Thank you.
Okay, so good afternoon, everyone, and thank you for all being here. And thanks to Vicky and Louise for providing us with a great level of information in regards to smoking and smoking in COVID-19. So I'm now going to briefly talk about, local provisions are available here in Birmingham. So as both Vicky and Louise have spoken about smoking and COVID-19, I'll just briefly highlight again that coronavirus, COVID-19, is a respiratory infection that affects the lungs and airways, and that smokers, if they were to become infected, are more likely to have complications if they are unwell, and their recovery time will be longer. Sorry, I just need to request control. Sorry, I'm just trying to move the slide. Yeah. So there are also health and well-being issues surrounding passive smoking, and it has been estimated that domestic exposure to secondhand smoke in the UK causes around 2,700 deaths in people aged between 20 and 63 years, and a further 8,000 deaths a year among people aged 65 years and older. A child who's exposed to passive smoke is at an increased risk of developing chest infections, meningitis, a persistent cough, and if they have asthma, their symptoms will get worse. There are also long-term effects that can be cyclical in nature, such as a child who lives with a smoker is twice as likely to become a smoker themselves. Pets can also sometimes swallow cigarettes and other tobacco products, and this can cause nicotine poisoning, which can be fatal. Every year, approximately 78,000 people in the UK die from smoking, with many more living with debilitating smoking-related illnesses. Smoking increases your risk of developing more serious health conditions, and some may be fatal, whilst others can cause irreversible long-term damage to your health. Smoking damages your heart, blood circulation, and lungs, increasing your risk of developing conditions such as coronary heart disease, heart attack, stroke, and chronic obstructive pulmonary disease. It's never too late to quit smoking, and with the right support, you're 3 times more likely to quit for good. So what support is available in Birmingham? The NHS have created a range of resources, including their smoke-free app, which is free. The slides should be available at the end of this presentation, so the link is just there at the bottom, and if you click onto that, you'll get more information. Birmingham City Council have recently launched their Quit with Bella app, which aims to ensure smoking cessation services are accessible to all smokers in Birmingham. The app can be used as and when needed without any face-to-face appointments. Again, this app, like the NHS one, is free. If you live or work in Birmingham, you can get support from your local GP practice or pharmacy. Please do visit the links that are on here, as you can actually put in your postcode and find out where your nearest GP practice or pharmacy that provides the stop smoking service is. So there are many benefits to stopping and quitting smoking, both short and long term. Stopping and quitting smoking will also have a positive impact on other people, such as those you live with and or smoke around, as well as other organisations. For example, it reduces unnecessary pressure on the NHS. Currently, around half of all smokers in England try and quit unaided using willpower alone, despite this being the least effective method. Getting support can greatly increase a person's chance of quitting successfully, which is why having an interactive stop smoking service in place is important. It's important to remember that despite having stop smoking services in place, that the specific drivers of smoking uptake and tobacco addiction must also be addressed. With the launch of this Be Healthy campaign, it's more important than ever to push for health and lifestyle changes within the community, such as quitting smoking. I've left our primary care email address on this slide, and this email is not to be distributed to members of the public only, those who work within the community that may have any questions. Thanks for listening to my presentation, and my colleague Syeda and I will be here at the end if there are any questions. Thanks.
Thank you, Rachel. Another really informative presentation with lots of options for getting help and support and suggestions that can be disseminated to the communities that you're working with. And as Rachel said, Rachel and Syeda will be here with us at the end for the questions. Moving on to our next speakers. So this section is specifically focused on smoking in pregnancy. So moving over to Richard Kennedy and Cassie Lowbridge from BUMP. Who are going to take us through the next slides. Thank you.
Yeah, thanks very much. And it's a pleasure to be here and to be able to speak to you about the problems of smoking and pregnancy. And I'm joined by Cassie Lowbridge, who will take over from me. I'll set the scene and give some context and the challenge that we are faced with. And then Cassie will describe to you some of the things that we're trying to do locally to improve the situation. Next slide, please. Oh, do I have control? Do I have control or do you have control?
I think public health.
I have control.
You do.
Okay, that's good. So, sorry, just getting my act together. So this gives you a global picture of smoking and pregnancy. And it's fair to say that Europe is the worst performer in terms of smoking and pregnancy. And within that, the UK shines high, and particularly Birmingham, as we can see that the rate of smoking at the start of pregnancy is around 10 to 12% of all pregnant women are smokers at the beginning. So that compares very badly with the more general situation that we see around the world. And one of the problems that we're grappling with locally is stillbirth rates and perinatal deaths. So these are babies that are, die either before they're born or in the early period after birth. And we have a particularly high stillbirth rate and perinatal mortality rate here in Birmingham. You can see how that compares to the rest of the picture in England. England is the blue line and Birmingham are the green and red lines. And we know that smoking is one of the things that we can do to improve this situation. Smoking, as I'll show, impacts on the rate of pregnancy loss. And this is really the crux of the matter. So this is a small baby, a premature baby, or a baby who is very growth restricted. And we know that when babies are born in this condition, then the challenges that they face in their early years and development and for their health outcomes are added to, so they are more likely to have a variety of different problems as they go through their early years, and their development is as a consequence impacted by this start that they have in life. And this is just to put some data to that for you. And so just the headline figures really. So a baby that is, so to a mum who's smoking, the likelihood of a baby being born, what's happened? I've lost. I've lost my signal.
We can still hear you, Richard, and we can see the slides.
Can you? Okay, I'm
yeah.
back. I'm back. I don't know what happened there. There was a glitch. So this just puts some figures. So the likelihood of a woman who smokes in pregnancy of having a small for gestational age baby, that's a baby below the 10th centile in weight, is roughly twice as likely. So they are 2 times more likely to have a small baby. They are about 1 3/4 times more likely to have a preterm birth, and they're 1.5 times more likely to lose their baby as a stillbirth before the baby is born. So these are significant risks in each of these important outcomes. Next slide. Okay, and this just gives you an indication. So there's a lot of figures here, but what I want you to take away from this slide is that smoking in pregnancy is a dose-related phenomenon. So what do I mean by that? So what it means is the more you smoke, the greater the risk. And the longer you smoke through pregnancy, the greater the risk. So if you just look at the middle column, small for gestational age. So as you can see, if you smoke more than 10 cigarettes a day throughout the pregnancy, then you are 3 times as likely to have a baby that is below the appropriate weight for that baby. So a dose-related phenomenon, and this just gives you graphically the impact on measurements of a baby. So these are each of these dots, black dots on the screen, are the different measurements of a baby that are taken through the pregnancy as measured by ultrasound scan. And as we can see, the more you fall below the horizontal line at 0, the greater the impact on these measurements. So the lower these measurements, the smaller the baby will be. And this again tells you that the longer you smoke through pregnancy, the smaller the measurements of the baby. And again, the impact of the baby after the baby is born, significant. So we know that the baby is more likely, if it's growth restricted or born prematurely, it's more likely to have longer term respiratory problems. It's more likely to have obesity. It's more likely to develop diabetes. And all of these factors and developmental problems, developmental concerns for the child are impacted on smoking. So there is much work that needs to be done, as one wise man once said. And I'm going to pass you on to Cassie now, who will continue the presentation and just describe to you some of the things that we're doing in Birmingham to try to help the situation of women who are smoking in pregnancy. Over to you, Cassie.
Thanks, Richard. So I'm just trying to work out how I manage the slide.
You tell me, and I'll slide, and I'll control.
Take control. So if you move on to the next slide, please. So yeah, so Richard's given us a bit the background and the context in terms of smoking in pregnancy. So I'm just going to give you an overview of what we're doing in Birmingham at the moment and what the current situation is. So yeah, quite clearly what we know is that stopping smoking during pregnancy is the single most effective thing you can do to improve the health of yourself as a pregnant woman and also of your unborn baby. And that's why we're developing a service specifically around stop smoking in pregnancy to support our pregnant women across Birmingham and Solihull. Next slide, please, Richard. So in terms of the sort of statistics and what we know about women in Birmingham and Solihull, we know around 10 to 15% of pregnant women are identified as smokers at their booking appointment, and this sort of varies from sort of 10 to 15%, and that's in line, more or less in line with the adult population across Birmingham of smokers, which stands at about 15%. We also know that when women are delivering their babies, the rate of smoking is around 10.8% at this point in their pregnancy. And this, again, is in line with what's happening across England as a whole, and with the rate standing at 10.4%. We also know that younger women and those from a lower socio-economic background are more likely to smoke. So what we want to do with our service is develop some additional support and some targeting to work more closely with those groups of women. We are working towards national targets, so the Department of Health Tobacco Control Plan, which, oh, sorry, if you just want to go back a slide, other way. One more, I think, one more. Yeah, that's the one. Yeah, I'll stick with that one for 1 second. And then we've also got local targets. The national targets are to reduce the prevalence of smoking in pregnancy from 10.5% to 6% by 2020. And locally, we're also looking to reduce infant mortality by 20%. And this reduction in smoking rates for pregnant women is a crucial part of this strategy. So the next slide, Richard, please. Thank you. So one of the key national strategies informing the work that we're doing across the local maternity system is Saving Babies' Lives Care Bundle. And this brings together guidance and best practice that looks to address reducing stillbirths and perinatal deaths through 5 key elements. And the first of those elements is looking at how to reduce smoking in pregnancy. So what the care bundle is recommending that local maternity services do is to offer carbon monoxide testing, so CO testing at the booking appointment for women, and also 36 weeks as a minimum. So ideally the testing should be done as many times as possible through the contacts with the women. Now we can't actually do the CO testing at the moment because of guidance around COVID-19. So we have the processes in place, but we're not able to do that. So at the moment, we're relying on women self-identifying as smokers. And once those women are identified as a smoker, we're looking at, we've developed an automated opt-out referral process for women. So they'll go straight into the smoking cessation service. And by doing this sort of automated approach, it's looking to reduce some of the stigma that women may feel around smoking in pregnancy and making it a standardised part of our offer through the maternity services. We're also looking to train all of our maternity staff so that they can have conversations at any time throughout their pregnancy around smoking, and start to sort of raise the idea around the risks of smoking and what our service offer is to women. And by reducing smoking in pregnancy, this will also impact on the other sort of 4 elements of the care bundle that look to reduce stillbirths and perinatal deaths, and it'll have an impact across all of the outcomes, and also on wider health implications for the family and society as a whole in terms of reducing smoking and less reduced health, negative health outcomes for children and the babies. So it's the next slide, Richard, thank you. So we started the service by launching a pilot project which took place in Erdington, and that was in partnership with Public Health, Birmingham City Council. I think what we can see from the figures is that the pilot project, which was to have a dedicated stop smoking specialist working with women in the Erdington area, and I think, you know, the impact of that is that service made quite a significant difference in the quit rates for women in terms of the 4 weeks quit rate and 12-week quit rate, compared to if they'd have been referred into the sort of standardised service for stop smoking delivered through GPs and pharmacies. And there was quite a lot of recommendations that came out of the evaluation of the pilot, and we've taken those on board into the rollout of our service across the city. And that has included things like having dedicated stop smoking specialists. So that's there. So we've employed 3 specialists at the moment. I think they're on this webinar as well, so they'll be listening in. So they're working with women at the moment, so as a dedicated role, but they're also working very closely with the maternity services and the antenatal services that are available. So as far as women are concerned, it's one service and it's one offer around maternity care. The other recommendations were around having a sort of electronic referral system. So once the conversation's been held with the midwife around stopping smoking, we get that referral really quickly and we can pick it up straight away whilst women are motivated to stop smoking, and to make sure that we're building on that quite quickly, and also that we would have access to nicotine replacement therapy, and we would that would be provided through vouchers that are sent to pharmacies so that women can pick up that prescription on a regular basis. So, next slide, please, Richard. Thank you. So the rollout of the service across the whole of the Birmingham LMS, Birmingham and Solihull LMS, happened on the 21st of September of this year. So it's only a very new service. It's been running for sort of about 3 weeks. And looking at the figures yesterday, we've had nearly 50 referrals into the service, and I think about 36 of them are sort of active referrals. The other ones are still sort of following up or have declined the offer of support. So the referral system seems to be working quite well. So this slide just gives an overview of the actual offer that's available to women and the support that we'll be providing from them. So the referral will come in from the midwife following the conversation that the midwife has had with the woman at their booking appointment or any of the follow-up appointments that they might have. And then our smoking cessation workers will then contact that woman within 24 hours to confirm that they've had the referral and to make sure that the women are interested in taking up the offer of support. This is then followed up by their first appointment, which we can do at the same time as that telephone call, or we can book it in within the next 5 days for women. And then what we'll do at that appointment is have a much more detailed conversation with them and personalise the advice and guidance, look at what their sort of triggers are, why they want to quit smoking, what their individual circumstances are, and agree a plan with them about how we would take forward the support, and also look to agree a quit date with them. And then following on from that, we look to support women over sort of a 12-week period of time, and we'll have weekly contact with the women. And that'll be through telephone calls, mainly text messages, face-to-face when we can start doing that, and potentially home visits as well, if that's supportive to the woman and if we feel that would be useful to them and helps them to take up the offer of support that we've got. And we would have a minimum sort of longer appointment, 4 and 12 weeks, to confirm that their quit rates. And at these appointments, we'll also be discussing the NRT prescriptions and the support around NRT. And vouchers will be given to, which go directly to the pharmacies at the moment for women to pick up to collect their NRT prescriptions. And we'll be doing lots of behavioural support and motivational techniques, and looking to refer women into additional support as well. So where we've got the NHS smoke-free apps or the Quit with Bella app and the additional behavioural support, and we'll make referrals into other services, as well as looking at other wider sort of health messages. So if women need other support around health and wellbeing, or mental health support. And we're starting to work with the mental health services as well to support women specifically around who have mental health needs. And what we've identified is there's a high prevalence of pregnant women who are seeking mental health support who also smoke. So we want to sort of see how we can sort of tailor the support to help them additionally as well. And alongside all of this, we'll be working really closely with our midwife team. So we'll have clinics that are based at the same time as the community clinics, so that so our support workers know the midwives, they're working alongside them, they can see the women there. And we'll also be feeding into the shared maternity sort of case note system, so that the midwives can see what support the women are getting, and we can see what's happening with the women as well, if there's anything that would impact on the support that they'd need. Yeah, and that's it really. That's the summary of the service. So I've just put there our contact email addresses. So if you do have any questions or want further information, please get in touch with us.
Okay, thanks, Cassie. So what we want to do really is ensure that the children that are born in Birmingham get the very best possible start in life. They've got enough challenges as it is to cope with their early years and through childhood and adolescence. And whatever we can do to improve that is got to be a good thing. Thank you.
Thank you very much to both of you. That was really interesting and informative, and again, lots of support that's available there for everybody. So as we said at the beginning, we're going to try and have a discussion or some questions at the end. So as the aim of these webinars is to support you to reach the communities you're working with, the discussion today is hopefully going to be focused around how you can support communities to stop smoking, or at least signpost them to some of the things that you've learned about today. So if you have any thoughts, any questions, or anything else related to smoking that you would like to try and find an answer to, please drop it in the chat now, or indicate if you want to come in and ask a question as well. I think all of our speakers are here. I can see we've got one, I think it's probably more of a thought than a question, but in the chat box. It's quite long, so I can read it so everybody's aware, and then maybe we could discuss the question that's posed. So I think it's a double-edged sword. On one hand, I can totally understand people wanting to quit and being more motivated to do so because of COVID and health-related risks, and that's great. But on the other hand, I can also see how for some people, the impact of COVID lockdown restrictions can create an increase in smoking due to anxiety or poorer mental health. As often, people who smoke will use smoking as a means to reduce anxiety and cope with stress, even if it doesn't actually do this. It's a tricky one. So I don't know whether, I thought it might start discussion, Jazz, thank you. So I don't know whether people who've been involved in the presentations want to give some reflections on that, or just for a few minutes. I don't know if anybody has any thoughts that they want to offer.
Yeah, sorry, go on.
Well, there are other experts around the table. All I would say is that there is help at hand. I think that's the key message. There are things that we can offer that can help you not reduce your need for the social aspect of holding something to your lips or taking in the nicotine, but we can help. So we can help you translate what is a bad tar-related habit to a nicotine replacement habit. And that is more beneficial. But I pass on to the others that know better than I do about these things.
Quite agree, Richard. I think that we very much understand that people's default is often to reach for a cigarette, to cheer themselves up, to calm themselves down, to celebrate something, to help themselves stop crying if they're upset about something. But there are so many other things that a good stop smoking advisor can suggest to people to fill that gap. And I think it really is important to fill that gap with something that isn't going to threaten to kill them.
I think just one sort of additional point to that. I mean, totally agree with everything Louise and Richard have just said there, and it's about making sure people know what support's available and have that support that they need to help them quit. I think the other thing that we've seen through some of the research is that actually we see improvements in people's mental health when they do quit smoking. So contrary to what a lot of people expect, we do see reductions in stress and anxiety, which partly linked to removing those withdrawal symptoms as long as people are using nicotine, as Louise said. So it is a message that we as ASH want to sort of promote, that it's not just about physical health, but quitting smoking is beneficial to mental health as well, especially with, as Richard and Louise said, all the support that's available.
Thank you, that's really helpful. Has anybody got, I know there's quite a few of you, I can't see all the panel faces on my screen at the same time. Just wanted to check nobody had anything else to add, or anything else they wanted to add, because I think that's the main question that's come in, or the main thoughts and observations, I think, more than a question. So I think what we'll do is we'll start moving on just to wrap up to the end of the slides, but if anybody has anything else, I will keep an eye on the chat box, so please pop them in. So this is the current Stoptober, or some of the current Stoptober campaign material that's available for everybody to use. So if you have social media, we're definitely sharing these on our sites, and yeah, feel free to share these with your communities. I think they're quite powerful imagery that's out there, most certainly. So we also have the Birmingham City Council Public Health Team have pulled together a COVID Champion programme. The idea being that we can reach people within their communities, and that we can make sure that the correct messaging gets out there. We're aware there's so much misinformation and communication on social media, and this is a way that we can make sure up-to-date, accurate information about COVID and everything related to COVID gets directly to the communities. So we're looking for people to come forward who would like to be COVID champions. They can then form a big network of people. There's training, support and advice for these people, and they will be first-hand receiving information from us that's as up-to-date as possible. So if you know anybody within the communities that you're working with, or if you'd like to do it yourself, the web address for registering is at the bottom there and can be found on the Birmingham City Council website. And from us, it's just a great opportunity to reach some communities that maybe we can't reach ourselves, and we know that there's better placed people to do it. Okay, so moving on to the last slide, I think that's just the keeping in touch. So as probably quite a few of you are aware, because I know there's some familiar names on this webinar that we've definitely seen at others, all of the information for the webinar, so the recording afterwards and all the handouts will be available on the website to download. You'll also receive an email with the link as well as you've registered. If you have any general information or inquiries that you'd like, you can contact us on the Healthy Brum email address. There's also the Public Health Commission's email address, that contract management email address that was shared earlier in the presentation, which can be used. If you have a COVID-19 related specific inquiry about an outbreak or a case, then the COVID inquiry email is there too. So I think that's all for today. And a really big thank you to all of our speakers that have given up their time and joined us today. Without you here, we can't do these webinars. So it's really important and we're really grateful to have your support, all of you. So thank you very much. Yeah, and we will we'll hopefully keep in touch with you all and work with you in the future. Thank you very much.
Thank you. Pleasure.
Thank you.
Bye now.